What's up, guys? My name is Pat Miller, physical therapist, coming to you from The Total Joint in Homewood, Alabama. And today we'll be talking about prehabilitation for the knee and hip, for a total knee and a total hip replacement. Okay, so what is prehabilitation? Prehabilitation, or prehab for short, is a way to help prepare for surgery. So what exercises can I do before surgery? How do I prepare my home environment? And ultimately, what can I do to get stronger, healthier, more mobile, to optimize my recovery after the procedure? The most common reason to get a total knee or a total hip replacement would be osteoarthritis of the joint. Now, osteoarthritis is something that a lot of people get. Usually it is when you have diminished joint space. You might have some bone spurs, you might have some pseudocysts in there. Your doctor would take an x-ray and tell you some of these things. Ultimately, that can lead to decreased mobility, that can lead to pain, some swelling of the joint sometimes, and ultimately you'll want to get that surgery done to be a little bit more mobile, happier, and less pain several months down the line. If you're doing your exercises like you're supposed to during prehabilitation, you should notice improved strength, improved range of motion, potentially decreased pain, and improved functioning. You might be more mobile, and a lot of those things might carry over to after surgery as well. You might be stronger, more mobile, less pain after surgery. You could also notice reduced time spent in the hospital, which ultimately might save you some money in the long term. I think it's important that we take some time to review some risks of getting a total knee or a total hip replacement. One of the big ones you have to be aware of is something called a DVT, or a deep vein thrombosis. A DVT can happen in somewhere between 1% and 3% of people that get these surgeries. You might notice things like increased swelling around your entire leg. You could notice pain. Usually it's about 3 centimeters or larger in the volume of your leg. You could be at increased risk if you have active cancer, if you're bedridden for more than 3 days. So if you notice any of these signs, particularly if you're having a hard time breathing, certainly let your doctor know. This might be something that they want to monitor and check up with you on. Another thing you might be aware of after surgery is the risk of infection. Now, they certainly do the best job during surgery to try to reduce that risk. They might give you some antibiotics before the surgery. They'll put a lot of stuff on your knee just to make sure that the risk goes down quite a bit. But it still might happen in about 1% to 2% of people that get these surgeries done. So if you get the surgeries, you might want to be aware of some signs to look out for if you have an infection. Some signs to look out for if you have an infection could be any pus formation around the incision site. You could notice a lot of streaking, red streaking from the incisional site, something we call dehiscence, where the surgical site actually pulls apart. Could be signs you'd want to look out for. If you have an overall feeling of being unwell, like you're feeling sick, things like that, you might want to let your doctor know and they can take a closer look at it. Now, for a hip replacement in particular, there might be some movements that your surgeon recommends that you avoid for a short period of time after surgery. For an anterior hip replacement or an anterior lateral hip replacement, a lot of times you'll notice the incisional site right here on the hip after you get the surgery done. Your doctor might suggest you want to avoid excessive hip extension and external rotation of the joint. In our experience, usually about a month or so after the surgery, but your doctor will give you more specifics about that. Now, extension of the hip is kicking your leg backwards, which in my experience, people tend to break if they're taking long strides right after surgery. And external rotation, we've noticed people kind of break that if they plant on their leg, their surgical leg, and they twist while they're turning. Might be something to keep an eye on right after the surgery for an anterior or an anterior lateral hip replacement. For a posterior hip replacement, we've noticed that they are becoming a little bit less common over time, but you still have precautions with those. So typically your doctor will recommend to avoid really deep squats, sitting in really low chairs or really low car seats for a period of time, crossing one leg over another, or rotating your leg too far internally. So, like I said before, if you're sitting in a really low chair, if you're bringing your knee really close to your chest, if you cross one leg over another while you're sitting, which is really common for people to do, you'd want to be pretty careful about some of those movements after that hip replacement approach in particular. In order to maximize your successful return to home after your surgical procedure, it might be a good idea to get some items for home to make sure you're maximizing your chance for bathing, dressing, getting in and out of a chair without as much assistance. You will simply have some pain, some swelling, some stiffness, which might limit your ability to do that independently. So we would recommend getting things like an elevated toilet seat, a shower chair, a shower mat, an installed grab bar, a sock donor, a shoehorn, a leg lifter, a reacher, and a long-handed sponge. An elevated toilet seat might be used if someone's a little bit taller. I usually say above around 6 foot or so. I would recommend getting one, particularly if you have a lower toilet seat in your home. Remember, it might be harder to stand up if something's a little bit lower to the ground, so an elevated toilet seat would really maximize your ability to push yourself off of that chair. Off of that toilet seat, stand yourself up without as much assistance from a loved one. A few things you might put in your shower would be a shower chair, an anti-slip shower mat, and a grab bar. Now, a shower chair would be really important because if you're trying to stand for a prolonged period of time in your shower after surgery, it might be pretty hard to do that, and you would be at risk of falling. So sitting down while you're bathing yourself would be fairly important to do. There's a few different varieties you can get. There's some that extend out of your tub, which you can sit down and kind of shimmy your way over into the shower. There's other ones that simply just fit directly into your tub that you can just try to transfer into the tub and sit down in. A shower mat is something that you could put both in and outside of the shower, which would help reduce your risk of slipping when you stand up and transfer in and out of that shower chair. And I would certainly recommend a grab bar as well. A lot of times people will find ones that are suction cupped to the wall. I would not recommend that. They can pull off of the wall too easily. So I would really recommend getting one that you can install into your wall. If you don't have one already, that you can grab one to help you get in and out of the shower. Some things you might get to help put your shoes and socks on are a shoehorn and a sock donor. A sock donor is a device where you can kind of roll your socks on into and help pull it onto your foot, reducing the need to lean over to try to bend your knee and put it on your foot. So it's really, really helpful to get one of those. And then the shoehorn, as many as you already know, really helps you slide your foot into your shoe without giving yourself a flat tire there on your shoe. Something that I found really beneficial for people after the surgery is something called a leg lifter. It's something that it's almost like a wire, a stiffer wire, and a loop at the end of it, which you can put around your foot to help lift your leg on and off of a table, on and off of a couch, in and out of a car, because it'll be harder to do that by yourself after the surgery, so you can help use your arms to help assist you on and off some of those things. So would really recommend getting something like that. You could also get a reacher. You might have a harder time going up onto your toes to get into something like a larger cabinet, reaching something on the floor. So it's a grabber that you can pull a trigger and help pick something off the floor. That way you don't have to bend down and pick it up yourself. You could also get a long-handed sponge. Now, a long-handed sponge is something that will also help prevent the need to bend over quite a bit. You can use that to get your back, your legs, without having to bend forward quite as much. So we would really recommend looking into getting a long-handed sponge as well. Really appreciate you guys watching this video. Make sure to like and subscribe if you like this content. Stay tuned for our next video where we'll go over how to go up and down stairs after your total knee or your total hip replacement.